I'm
I
here.
you know,
I think
you've
they just a
never
minute or two escaped me. Sorry about that.
you've never not been on, so I wasn't worried at all. So,
No, it just escaped me. I went, oh my God, look at the time. I better run. Here we are.
so I know you're busy. So,
Oh, always
none.
something.
Yeah.
Always something.
So, a lot of questions. I'll get right at it because I got a ton of them.
Okay.
The question, obviously, everybody, and I'm going to be asking you this every week because it does change. It's fluid. It changes every week. We are 1 week into this lockdown. And Mississauga's numbers are going down, right? On a week by week basis. So, do you see Mississauga getting out of the lockdown by December 21?
Maybe. Yes, I hope so. Um, so they're stabilizing. I don't know how down they were because 2 weeks ago they were 100 cases per 100,000. And then 2 weeks after Diwali, now they're 110 cases per 100,000. But they seem to be stable and they're not climbing at an exponential rate as they used to. And we had a couple of blips that apparently were cases that were thought to have been negative became positive or weren't in our region, but that were. So a little bit of blip in numbers, but they are stable. And so we are at 110 per 100,000, and the positivity rate has gone down 6.8%, which is good. We're lower
Okay.
than Caledon and Brampton, frankly. So that's good. So we are stabilizing. So, I mean, to be in the orange zone or red zone to have 50 people in for dinner at a restaurant, we have to be 40 cases per 100,000.
Okay.
So, I would love to make the case that Mississauga is ready to come out of lockdown, but I need help. I need everybody doing their share and, staying home as much as possible, going out for only the essentials and not socializing, just staying home with their immediate family and essential supports. So that's what I
Um,
need people to do.
okay. So just, I mean, I guess realistically speaking too, I mean, let's just say even if the case numbers get to that point, would December 21 be the best time to let everybody kind of do everything? I guess, with,
I mean, I would be concerned. I would certainly want the stores to reopen. I've been asking that they be reopened safely because I think there are people who feel safer shopping in their local retailer than they do at those big box stores that are, quite frankly, are not managing their crowds and they're over capacity and people without masks and it looks like Christmas Eve in some of those stores. So I think people feel safer in a small local realtor and they want to support those. I mean, I was doing some Christmas shopping online last night, and I got to tell you, I bought a couple gift certificates for just local people. So that's my plan, and I hope other people do that too. I would worry that if we reopen everybody on the 21st, that just gives them, you know, 3 days before Christmas, and they
yeah.
don't use the kind of restraint that they need to. But maybe, oh, gee, I mean, I want to
Well,
get them open as soon as possible. So whenever it is safe, we should reopen them. I mean, they're hurting, and we know they're hurting, and we hear, uh, yeah.
you talked about you had a motion last week to stop the non-essential goods and big box stores and Costco's and Walmarts, and but unfortunately that got scrapped. But it was put in. I guess it was a motion put in to ask the province to step in to address the serious disadvantage of small business. So has the province done anything, or has the province got back to you in regards to that?
So I will share with you that the next day I was on a call with Ontario Big City Mayors. I was elected vice chair. Very pleased
Yes,
about that.
congratulations.
Thank you, thank you. That means should I be reelected in 2 years, I will serve as chair in 2 years. So that's great, great news. And it did come up on the call with Minister of Finance Rod Phillips, and I made the same impassioned plea that they control the non-essential aisle in the big box stores because on a fairness and equity basis that they've built up an unfair competitive advantage for these stores who are profiting, and not to mention sending profits south of the border to their headquarters. Meanwhile, our local entrepreneurs, our local businesses are suffering and shuttering, and these are members of our families and members of our community. They give back to our communities. So he had said that they were actually watching the motion closely. So I felt bad. I felt a little bad, but he does hear us. All the mayors said the same thing, that they want stores, small retailers, open as soon as possible, as soon as it's safe to reopen them. And I will share that public health has a lot to do with this, whether it's restaurants or small businesses. I mean, I could go to the premier with a letter from my public health official signed by myself and Dr. Lowe and say, you can ask him this. And, you know, if we say we'd like to reopen businesses and restaurants for indoor dining with a limited capacity, if Dr. Lowe signed off on it, the premier might do it.
So let me ask you.
But Dr. Lowe won't.
Oh, so Dr. Lowe will not sign a paper that says that, you know,
it's because it's against his best advice. It's against his best advice that we would do that.
Okay, interesting.
So he wouldn't. So we have to wait till the province takes that initiative. And he sits at that table with Dr. Williams and he gives input. But you know, the medical officers of health, including Eileen Davila, they're always the ones who are the most rigid, the most stringent with the rules, right? They want to impose more and more restrictions. They're the first ones to suggest the lockdown. So that, you know, they're not the ones that will be opening us up anytime quickly.
So let me Mayor Crombie, you sit on you're the vice chair of the Big Cities Mayors Group. Is that what it's called?
Of Ontario.
Of Ontario, okay.
Because there's also a Big City Mayors of Canada.
Okay, of Ontario. And most of the mayors agreed with your motion in regards to, you know, stopping the sale of non-essential goods on big box stores? Well,
I will share that myself and Mayor Tory and Mayor Brown were the most vocal about it. And certainly Minister of Finance said they would take it back. And he actually shared, as did the Premier, that this is an issue that comes up at the health table regularly. They are considering it. They are considering the right time to reopen small business. So we were the most vocal. And then it came up again on GTHA mayors on Monday. And the other communities aren't in lockdown. They're in red or orange. So they do have stores open. So it wasn't the same issue for them as it is to the mayors in lockdown, right?
Okay.
Right? Right. They understand the fairness, equity, unlevel playing field argument, but they're not affected because their retailers are open. Their small businesses are open. They may have limited capacity, but they're open if they're in red or in orange. It's only in Peel, Mississauga, Brampton, Caledon, and in Toronto that all our small businesses are closed, except for curbside pickup and delivery, right?
Yeah. Okay. Yeah. I'm sure you talk to a lot of businesses. I talk to a lot of businesses too, and they all the restaurants and, you know, mostly the restaurants that I talk to, I try to do takeout literally almost every day.
Right? Yeah, we do. My daughter and I too often, in fact.
Yeah, and that's fine though. You know, it's a good excuse now, right? But I mean, exactly. I talk to them all the time, and they know that I talk to you.
Tell her. Well, the other misperception people have is they think that I can change it, and I can't because I'm advocating for it all the time. But you know, they'll yes, mayor. When when the circumstances allow, when the numbers, when the data supports it, when the evidence supports it, we will reopen safely. So I don't make those decisions, and they have to know that. We advocate, certainly we all do. Mayor Brown and I both do. You've heard us say, you know, leave the gyms, the restaurants, small businesses alone. They're not the source of the spread. But those decisions are made by recommendations from public health officials at the policy table at the province. The health and the policy teams of the province that give advise the premier, and he solely makes these decisions. I know I've heard from many of them as well. You need to reopen business. You need to do this. You need to open restaurants. This isn't fair. And I just say I agree with you, and I'm doing my best, but it is not my decision, right? It's a decision of the province with input from public health. And I feel bad for the premier because he has that onerous task of balancing businesses and public health.
Sure.
Right.
I'm sure you have a lot of influence, though. So
we sure do. Well, I try. I mean, I do speak to him regularly. You know, and he's also juggling 28 public health units, some of which are open and in, you know, green or yellow. Only the ones in the Golden Horseshoe are, you know, if you start in Niagara, or orange, or Hamilton's in red, Halton's in red, and we're in lockdown. So everywhere, many other places aren't facing the same situation and are, I won't say COVID free, but have far fewer cases, because it makes sense, big city, lots of density, highly populated areas, etc. The risk of transmission being so much greater. So it makes sense. So he's juggling. That's why he can't apply anything province-wide. There has to be zones. I think we first saw this in Quebec, that they were imposing things by area, postal code, or zones.
True.
And he took the same approach, right? Because there are areas that are less affected.
So your hair looks good, don't worry.
Oh yeah, it's like I see this little bit. All right, never mind. Sorry. What's the next question?
So let's just say, come December 21, our daily case rates have gone down. The daily COVID-19 percentage is under 40, right? At that point, can we, figure out a plan to open small business through?
Oh, yeah. Well, I mean, we're starting to see a downward trend, for sure. I mean, we're seeing some stability now, and we had been seeing growth, but not at the same rate as we'd seen it in the past. But now, the other problem is it's just not on case rates and positivity rates, right? We have to look at public health. Can they still do the contact tracing? And I'm told after 300 cases in Peel, they can't. And they're getting assistance from other areas. Like I know Barrie has, Mayor Lehman has offered people from Barrie to come help us do contact tracing. In fact, we've laid people off, but a number of people were asked to be redeployed, and some of them were asked to go do contact tracing. We've because our cultural facilities and our rec facilities and our libraries are closed again. We've asked some of those people to be redeployed in other areas, and contact tracing was one of them. But then we look at long-term care facilities. Here, where are the numbers? 19 long-term care homes, 7 retirement homes, and 4 group homes have outbreaks, right?
Today?
That's the current status. I got that last night. And then Tyndall is not in good shape at all. They had 90 cases among residents and another 80 with staff, and not a good thing. It's 50% of our LTCs are currently in outbreak.
Okay.
And we have 28 homes in Peel, so that's a lot. That is a lot. And then we have to look at the hospitals and the capacity there. And we know that Trillium is, I think, what did she say? She had people in beds in the hallways, 92 awaiting beds.
Wow.
And William Osler transferring patients out that they can't safely administer to treat. So they're not accepting ambulances either. We're not quite there yet in Mississauga, but very, very close. And we have outbreaks in 2 units. And I think you wrote about that today. In 2 units, there are outbreaks at Trillium Health, cardiac surgery and in ICU. So, when the hospitals are at maximum capacity, meaning people aren't getting treated for anything other than COVID, if you need renal dialysis, or you've had a heart attack, or you think you have chemotherapy, you may not be able to go to our hospital to do that. So that's where public health says, no, pause, stop. We have to close down as much as possible, because the hospitals need to get back into treating people, as they said.
Yeah, you have a tough job. So does Doug Ford. It's a no-win situation right now.
To kudos to Doug Ford. He is very responsive if I text him or call him. If I text him, he'll call me right back, and I think that is very responsive. Or maybe if not right then later. He's obviously in the middle of something, but he is very responsive, and he's willing to hear me out. And then he'll say, well, Mayor, that's not what the health officials are telling me, right? But he is responsive, and he does listen.
Okay, good. Let's talk about the party that an Airbnb.
We're calling it a short-term accommodation, because we actually aren't even sure it was an Airbnb platform. I mean, unless we call it short-term accommodation. There was some site, right? So I have the What's that?
I wasn't there.
Well, no, you're too old.
No, okay, thanks.
It was a younger demographic. I'm hearing from bylaw it was a younger demographic.
Yeah. I'm just kidding. So 50K on.
We took a very hard approach. Yeah, is that the number you got? 50 hard. So 29 charges were laid. 25 of them were part one, which is the $880 for people being present at a house party. 2 of them were the part 3 summons, so that's the hosts of the party. So that is a minimum of a $10,000 fine. That could be upwards of that could go to 100,000. And by the way, the justice of the peace is they're starting to hear these fines, these cases where people have been fined earlier in the pandemic, and they're holding.
Oh,
they're holding.
So they have to, okay.
They're holding. So yeah, I mean, you know, if you,
that was going to be my next question. So
they're holding. So there, yeah, it was a very young demographic, and they're still looking into who the people were and etc. But I will share with you, I'm probably not supposed to do this, my staff are about to cringe.
Please do.
There were people from other areas, from many regions. It wasn't Mississauga based necessarily. There may be a few Mississauga people, there are people from everywhere.
Okay. Was that the information that your people were going to cringe on? That information? Okay. Just wondering. So,
well, because they told me that we're still investigating. Don't repeat that yet.
Okay. Thanks for repeating it here.
But you like, you know, cutting edge information. So
yeah, so do our viewers. So
yeah, I know.
Yeah. 1.5 million people have seen this so far.
Oh, boy. Excuse me, I have to talk to my chief of bylaw.
Yeah, okay. I said, what's up? He knows me. I'm kidding. So are these the city bylaw officers that go out? Is it a proactive approach or a reactive approach?
Yeah, so it's both, right? So I have those numbers. They've gone through, I think, 4,000 businesses. They've quadrupled the number of visits they've been making over evenings and weekend shifts in particular. Let's see if I can find it. And so over the Black Friday sale weekend, not bad. Not too bad. I must say, it wasn't so bad. Did we talk about this already? So we had an appliance store, an electronics store, some car dealerships, but not too bad. You know, certainly not what you saw in other places, but many of those had been capacity over capacity. So not to a pet supply store, appliance, car dealership, a gym, home decor, some private gatherings, which were enforced. So they have been, let's see the number, public complaint, and just on the weekend we had 100 public complaints. We've 57 charges since lockdown.
Okay.
Yeah, so that's not bad. They're so and proactive. Oh, here, proactive. This is good. They've gone to 4,500 inspection sites. So inspection site could be a home. I can't say a business because it could be something other. It could be a commercial site. It could be a residential site. It could be a business, right? Could be anything. Compliance rate was, they're saying 99.5%. So that's excellent. So those are their proactive inspections.
Are proactive inspections surprise inspections that they could walk right into businesses? So they have the right to?
Well, it's a business. It's not going into somebody's home.
Okay. Okay.
But with the house party that we saw, they knocked on the door opened, and they said, "Hi, we're here from the City of Mississauga bylaw. You're breaking the law."
I heard a lot of people ran, so.
A lot of people ran through windows and doors and jumped fences. That's true. But the how many people? 25 people that stayed got fined big time, and the 2 hosts were charged as well.
So we're 20 minutes in. So I started this new thing, Mayor Crombie, where I just ask the Instagram followers that Mississauga has to ask questions for you.
Great. Okay.
And we got tons. So some of them are not your jurisdiction, but you can kind of give your 2 cents.
Yeah, please do, because that's really important for people to understand. Even the people who come to me and say, you're hurting small business, you need to open business. And I try to explain, I believe you, and I think there is ways that we can safely reopen businesses, but unfortunately that's not a decision I can make. So please, yes, let's hear that.
I do the same thing.
Mm-hmm.
Yeah, I do the same thing for you too. When they ask, I'm like, well, you know, Mayor Crombie's not in charge of that, but I could ask. But anyways,
sure.
Will remote learning be provided for the next year's school year?
Right. So the other area I don't look after is education. Yeah. So I don't know that. I don't know. And you know, that will be a decision that will come down from the Minister of Education. And I will say to you that right now everyone is focused on the vaccine and rolling it out and the logistics behind that, how many we purchased, you know, how, and obviously frontline healthcare workers, essential workers will be the first to receive it. But still, I got the numbers, where was it from? The vaccine. It took us, for H1N1, took 3 months to administer 86,000 residents, which was only 30% of the population. But they feel that we need to vaccinate 75%. So it will take the better part of next year to get that done. And we'll have to go to different sites, and people will need to be trained to assist. I mean, nurses, nursing assistants, probably the military, etc., will be trained to assist to vaccinate. So I would suspect that there will be those online options, work from home options, until there is at least 75% of the population vaccinated.
The next question we have is, COVID has revealed a gaping hole in childcare. How will this be addressed so people can go to work?
Yes, well, I agree with the person. There's always been holes in childcare. I think we could have done much better. I mean, I was certainly in the federal government when we were talking about a national daycare strategy, a national daycare program. Sadly inadequate, and particularly for people who need to work. And you know, even people who are working from home, that could be a big distraction if your children are at home and you know, you feel you need to supervise them, and you've got a deadline, right? So you sometimes, even though working from home, need to take your child to daycare or to childcare. So yeah, it's pretty difficult. Once again, not something I manage, but I certainly sympathize as a mother that would be a big, as a working mother, a big challenge.
Another question we have.
And for all parents, really.
Sorry. Yeah. Another question we have is, where is the help for essential workers who have to travel to and from this pandemic, I guess, to work there and back?
So if they get sick, I mean, if they need isolation to quarantine, or what do they mean?
I think for an essential worker, I think maybe let's talk about, you know, somebody that works at long-term care, you know, I guess that have to travel from home to long-term care center. Is there any, I guess, pandemic pay? So
again, the province, they created a list of those eligible for pandemic pay. Certainly, yeah. PSWs were on that list. I think grocery workers were on that list, rightly so. We don't think about that, but of course they're essential to us. You know, waste management people and our transit drivers, those are essential workers. You know, we immediately think of frontline healthcare workers, doctors, nurses in the hospitals, and then police, paramedic, fire. But think about all the other people who are essential, and especially those in the seniors' homes, the long-term care homes, and the grocery workers, people in essential retail like pharmacies. You know, those are those people. But I guess the upside is that they are employed and being paid. I don't know whether the pandemic pay is still in effect from the province. There was a top up for a period of time, but I think it was just for a period of time.
Here's one I think that's within your realm of jurisdiction. Is why did Mississauga get the isolation center and not Brampton?
So there was an existing center, there was a shelter that was expanded. With additional money, it's easier to grow what exists, expand what exists, than go to a new location. So we expanded the existing location, the existing center. And Brampton, Mayor Brown feels that it doesn't serve the residents in the Northwest where he has the most acute and severe cases. Right, that's where that 20% positivity is. So, I mean, I think the idea was that it was central enough, our location. It's quite frankly the north end of Mississauga, without saying exactly where. Close enough to Brampton that it accommodated both Brampton and Mississauga. But of course, Mayor Brown makes the point, and rightly so, it's a much greater distance to the northwest of Brampton. Right, where his most severe cases are being transmitted.
Okay. Those are all the questions I have. Is there anything else you'd like to talk about?
Hmm.
You still doing F45?
Well, in virtually.
Oh, I guess, yeah.
Virtually, right? Yeah. So virtually, and so we do it in the basement, my daughter and I, and there actually even you can pull up the routines on the workouts on Facebook too if you miss it. You can either go into a class and watch it, or later on it's taped and you can go on Facebook and do it yourself. So yeah, yes, we are. We're trying our best. It's always better to be there,
Of course.
but yeah, we are. Um, what
Let
else?
me,
What else can we talk about?
I have a question, and
Okay.
this is brought up because of everything that's happened over the last week in regards to, there's protests in front of Doug Ford's house. There was, I don't know if you heard, but Fred Eisenberger there was a coffin outside his house yesterday.
Oh, I didn't know that. No. Oh
Yeah,
gosh.
so yeah, so anyways, it seems like the protests are, going into personal space of politicians. And, Doug Ford said, and I agree with him, it's an unwritten rule that, obviously you don't protest at, people's personal houses.
Mm-hmm.
What are your thoughts on this?
I completely agree. I mean, I have a family, I have children, they live here, I have neighbors. If you want to protest me, come to City Hall. That's my
Yeah.
office. That's the right place to do it. I don't have a constituency office like the premier does or some of the federal or provincial politicians do. I don't think it's fair to bring it to their homes. In fact, we heard there was a rumbling. I got a call from Peel Police that they thought that people were planning these types of activities. But it didn't materialize, and I hope they don't. I mean, I think that's taking it too far. Even politicians deserve their private lives, and I mean, I live with my daughter, my sons. That's not fair to them or fair to my neighbors. This is where I come for, it's serenity. I know I think they've really crossed the line. Even with the premier, I mean, that's his home, his wife
Yeah.
and children. Come on,
Yeah.
that's not fair. That's unfair. But we do see rising protests. There was one in Celebration Square on the weekend, Saturday or Sunday, that drew a crowd, and the organizers will be fined because they had too many people and they weren't safely distanced and many weren't wearing face coverings. But we do see a frustration among people that this has been going on a long time.
Okay.
And they're tired of it, and it's a COVID fatigue. And then there's a group that challenged the science, quite frankly, and don't want to follow rules. There's that group as well, and we know who they are. We saw them at the Adamson barbecue as well.
Yeah.
So I think this has just tested people's patience. I think it has. It's starting to wear on people.
Yeah.
I think it's been the source of a lot of stress for people. It's certainly the source of my stress as well, and that's why it is good to work out and have outdoor activity and go for a walk, bike ride, whatever. Well, mind you, it's snowing. Well, it's cold out today, but
Sure.
whatever you can do to get some peace of mind. So, but it is draining on people, and people are struggling, and some have been unemployed or have to close down their businesses and then reopen, and they're in lockdown. And when I think of the restaurant workers, what are those people doing now that we're told they're going to go to 28-day lockdown? I heard some of them are going to the grocery stores or the LCBO. Some of them were going to go to be contact tracers. There were some other venues for them, but not all. They're home collecting probably served from the federal government. So it's so much uncertainty in people's lives, and people don't know, when will this end? Is it real? There are people who question the validity of this, and even the former president of the United States did as well. Correct?
Yeah.
Thankfully,
Yeah.
former. So this is a very stressful time for people. And and I worry about people's personal situations, not only their financial situations, but their mental health. And when people are home together too long, particularly if there's any domestic abuse issues that would be exacerbated, mental illness issues would be exacerbated. I mean, that's the kind of things that I'm worried about. It's not just that people are struggling financially. Of course they are. Many have been closed down, but there's a greater impact than just that, right?
True. Your address is the City Hall. All right.
Yes. But what was our maximum outside? 25. And even anything more than that, and you will be ticketed.
Mass over Kisses rally that was this Sunday will be fine.
No, I think it was an offshoot of that group that was there last weekend.
Yeah, they were. Yeah, is it Mass? No, Hugs Over Mass. Anyways, it's one of
Yeah,
those.
that's right. But that was part of that same group that was there this weekend.
Yes.
And
Yeah.
they had too many people and were not safely distanced. Many weren't wearing masks, and no, they were fined. The organizers were fine and the individuals were fine. We're going to take a very strong approach. I mean, you want to protest, we understand, but you got to, the rules apply to you too.
True. So, Mayor Crombie, thank you so much. I will catch you next week. I don't know if we're doing this in December, but I'll talk to your awesome team and
Yes,
see what.
thank you. Thank you. Yeah, I'm going to try and take some downtime too. I don't know exactly what I'm going to do, but
Yeah.
you gotta at least unplug for a little bit. Even if we have staycations, then
100% agree.
Unplug. Maybe I'll go clean my closets or something. Right?
If I don't talk to you until next year.
No, you will. You will. No, you will. Yeah, you will. I might take a break, towards the Christmas holiday and maybe the week after, but no, I'll be around for another couple of weeks. We'll be together again.
All right, cool, perfect. All right, see you later.
Thank you.